Good afternoon. I'm Sheriff Tony Thompson. Welcome to this, the 11th briefing from the Blackhawk County Emergency Operations Center on the COVID-19 virus. And this will be one of our significant updates. Today's briefing is all about special populations here in Blackhawk County that we want to make sure are communicated to and aren't left behind during this significant time. So as you see in your roster, we have several briefers today. We may go into native tongue a little bit today to make sure that we don't, or that we get our message across in a unique and significant way. But we also wanted to make sure, and I'll take care of the housekeeping things first. At the EOC planning meeting this afternoon, it was determined that we don't want to keep putting stuff out in front of you every single day only to put slightly different spins on the same message. So today and tomorrow we will brief, and then we will not brief again until Thursday. And on Thursday, that will be our last briefing until Monday. And then from this point forward, we will brief Mondays and Thursdays, unless we need something specific. And you know we've got the 11 o'clock time frame earmarked for something substantial, and we've also got the 3:30 time frame earmarked. So if something substantial comes up, we will put a press release out. Otherwise, starting next week, you can expect us at Monday and Thursdays at 3:30 p.m. But today, tomorrow, and Thursday this week, that starts us on the new schedule. Anyone have any questions on that before we kick off this week's briefing? All right. As always, we will start off with our incident commander and the director of the Blackhawk County Health Department, Dr. Nafissa Cisse-Egbounye.
Good afternoon. As of today, 3:30, we have a total of 6 confirmed cases in Blackhawk County. The Blackhawk County Health Department, in collaboration with our local partners, continue to work together to meet the needs of the community during this difficult time. Although our confirmed cases are low relative to other larger counties, this is still a serious situation, and we need everybody to continue to do their part in slowing the spread of COVID-19. We're still preparing for those numbers to increase. Protecting the most vulnerable populations from this pandemic is the responsibility of all community members. Based on currently available information and clinical expertise, we know that older adults age 65 and older, people who live in a nursing home or long-term care facility, and people of any age who have serious underlying medical conditions might be at a higher risk for severe illness from COVID-19. As of this moment, we have a total of 6 deaths from COVID-19 in Iowa, all among older adults. So I ask that everyone do their part by staying home. If you do not take the preventive measures seriously, you risk getting someone older who sick, or someone who may have an underlying condition sick. Residents, please stay home. By staying home, you are helping to reduce the spread of COVID-19. You're helping the public health system, the healthcare system, and all other essential workers conduct safely their job that are critical at the moment. Businesses, as we ask people to practice these preventative measures and stay home, especially when sick, we also ask of you to be flexible with your employees during this difficult time. Many low-wage workers are afraid to lose their job and feel they cannot afford to stay home if they become sick. Employers, please maintain flexible policies that permit employees to stay home to care for a sick family member or take care of children due to school and child care closures. This is not the time to penalize employees. This is the time to do the right thing. I know employees are important to the operational needs of an organization, but we do not want sick people to go to work. Please have your employees stay home when feeling sick. Employers, please be cognizant of the Families First Coronavirus Response Act, which take into effect April 1st. Please check with your labor attorney if you need any legal counsel regarding this act. So I say this wholeheartedly. Lastly, as I leave you all, this will end being victorious. We as human beings, we will be victorious, and if we all play our part in implementing the preventative measures, we will overcome this pandemic. Thank you.
Before I introduce our next speaker, I would like to take Dr. Nafissa's conversation and briefing one step further. I have had to have the unfortunate opportunity to converse with several different organizations and groups with regard to the governor's proclamation from 17 March. And I'm going to read to you one piece of it out of Section 3, Item E, that talks about mass gatherings. And it says, social, community, spiritual, religious, recreational, leisure, and sporting gatherings and events of more than 10 people are hereby prohibited at all locations and venues, including but not limited to parades, festivals, conventions, and fundraisers. Planned large gatherings and events must be canceled or postponed until after termination of this disaster. Period. There's not a lot of room for wiggle in there. There's not a lot of room for interpretation in there. And unfortunately, here at the EOC, several different circumstances have come to light that we are calling people out on. Again, not here to socially shame anyone, but we are looking for that cooperation. Again, no organization wants to be on the bad side of this. No organization wants to recognize a congregation or their group to be at the receiving end of the spread of this. And we are just starting to get into that surge period where we'll recognize significant spread. Don't forget, 10 days ago in the state of Iowa, we only had 44 cases. Now we have 424. So please take a look at that bigger 50,000-foot view. This is important. Our next speaker, and again, today is Special Populations Day, and we recognize that our aging population is probably one of the most vulnerable and most significant here in the state of Iowa. We are bringing the CEO from the Western Home Communities, Mr. Kris Hansen, up to brief you today.
Thanks, Tony. Good afternoon. I want to just follow up on what the sheriff just said. I'm an old deputy sheriff myself once upon a time down in Benton County, and the whole idea is to not shame people, but the group that I'm here speaking on behalf of the senior population, those in nursing facilities, assisted living, I'm going to speak on Western Home's behalf, but also as the whole profession. If you continue to have these gatherings, it puts our employees, the opportunity for our employees to get in a very tough situation on what to choose to participate in, what not to. Then all of a sudden they show up and they're asymptomatic inside of our organizations and our buildings trying to take care of our seniors. And the problem is, it's not the 3 to 5%, probably not even that, mortality table that happens inside of our buildings, because folks would not be in our buildings if they weren't old and if they weren't compromised. And so if you introduce that virus into our buildings, the chances are the mortality table goes to 30 to 50%. And I will tell you, we are doing everything we can. We've been ahead of the curve as a profession to try to do employee screenings, to do visitor screenings, to not do any visitations unless it's end of life. And we really need the folks in this community. We're doing a very good job, but we really need the folks in this community to focus on the we, not the me. I heard the emergency response or headquarters down in Lynn County, I believe it was Dr. Arnold with Unity Point. I don't know how to, I've quoted this what he said for the last 7 days. I don't know how to put it any clearer than, which one of your grandparents do you want to put at risk to die because you're not willing to stay social distancing and practice that? So just please, I know it puts everybody in a tough spot, but that's what we've really got to do. And our folks are a lot of times out of sight, out of mind in our nursing facilities and in our assisted living buildings. But please make them forefront of mind, because the last thing that we also need to do is have that kind of spread go through our buildings. Then that clogs the health systems. And all of a sudden we're putting our docs and folks in the triage centers in just a terrible, terrible situation on who they're going to choose to live and die. So I'm pleading with you, please practice, social spacing. With that said, I will tell you that I think the profession around the state, certainly in Black Hawk County, and at Western Home Communities, we're doing our very best to try to bring virtual visits in. Our folks are getting very creative in how they hallway bingo, all kinds of different things to help our residents through this tough time. I think we're also trying to help we're trying to help our families as well, because it's hard when they can't have the normal visitation that they would have had. So again, we're trying to do that as virtual as possible. I would also tell you that we have a lot of independent living, independent congregate buildings, and just independent and patio homes. And I know Donna's going to come up and talk about that as well. But I plead with our residents there too to really think before they go out and go to stores, and there's absolutely things that have to happen. But please, again, think about your neighbors. And our folks have done a fantastic job of staying home. We've gotten very creative with our grocery stores that have been willing to drop things off. We deliver the pharmacies. So whatever we can do to continue to help our residents, and I will say our residents, we're trying to convince them to shelter in place. It's a little bit higher level that we're trying to do just because of the vulnerability of that population. But overall, I can't thank the community enough, but certainly please keep our residents in your thoughts and prayers, and all the seniors in Black Hawk County, well, all of us. Thank you.
Our next briefer is the CEO of Northeast Iowa Area Agency on Aging, and that is Donna Harvey.
Thank you, and I'd just like to echo what Kris said. And as you might guess, all the area agencies on aging. Why do we have the longest name for a population that struggles? Across Iowa and the nation are dealing with the same thing, trying to be creative. The one thing we're focusing on through our agency is food insecurity. So we used to offer 5 meals a day, either at a senior center or a home-delivered meal. As of last Friday, we've upped that to 7, and we're putting a plan in place by the end of this week that'll go to 14. So anybody that's 60 years of age and older that resides in our 18-county area, we are going to try to get you 14 meals per week if you need them. So we want to focus on those individuals who don't have transportation, that don't have close family members to shop for them. I will tell you, I got a call right before I came here with a group that's wanting to put together volunteers to help older individuals. Normally I would say, that's amazing. But when I heard they wanted to go in and prepare meals, they wanted to clean their house, I begged them not to. And that goes against everything we normally try to say to take care of our own, but we're at a whole different time. And so if you can encourage individuals there's a lot of ways to help homebound seniors. A call would be awesome. They're all very lonely. You can donate through other organizations, but please do not go into their homes. You never know what you're bringing with you or who you're bringing with you. So that's our plea. We are all connected as area agencies on aging, and I'm going to give you this number, and you'll see it and hear it a million times. It's 866-468-7887. That number rings in, and it has a pre-selection of area code and first 3-digit prefix to your phone that will get you to the area agency on aging that serves you. So even though you might have a loved one in Davenport, that will ring you to Davenport. And we can connect you if you do not. All the area agencies are looking at trying to make sure that we have adequate food sources. we are going to begin contracting with local grocers and restaurants to help us get those meals out, particularly in very small rural communities that don't currently have services. So while we can provide other support, we do fund home care. We're going to reach out to organizations like Kris and others that provide home care to see, can you increase the amount of service you're providing to folks that may need that a little bit more? And we oftentimes get a call for somebody that needs their house clean. Honestly, we're saying you can live in a clean house. We want to focus on getting you bathed, getting you fed, and making sure you're healthy. So we're trying to look at the prioritization. We are very fortunate in that we are receiving additional funds through the last 2 stimulus bills. So that is the luxury we have that some of the other nonprofits do not. So that's why we're busy pushing out everything we can as quickly as we can. So again, to qualify for our services, it's age 60 and over. Their spouse, regardless of age. So I always like to say, if you marry an 18-year-old, bring them along. They get our services as well. And then caregivers. So I'll just talk briefly about that. We believe that caregivers are going to be under additional stress. We have many caregivers that live with an older loved one, and we do have funds available for respite. So again, we contract with those home care agencies, and they too are some of the lower income that are begging to be employed, and so it's a great partnership. So we want to be your community partner. We want to keep our older population safe and not carry in anything we can't, and to make sure that they're able to stay in their home. So thank you very much.
All right, now we're going to shift focus just a little bit to our English as second language, some of our immigrant and cultural populations here in Blackhawk County, some of the diversity population that makes us so great. And we're going to start off, we originally had Embark here, and we had some technical difficulties with them. I had some technical difficulties even saying that. But in replacement of Embark, we have Umaru Balde, who's a community activist with Cedar Valley Advocates for Immigrants and Refugee Rights. Umaru?
Good afternoon. Thank you, Sheriff. My message basically is pretty short, is to let the community, mostly the African community, know that there are resources if you have questions. There are so many different organizations, as already some of the people mentioned, that you can reach out to, especially the Blackhawk County Department of Health. Another thing is we have been getting messages through our Facebook page and the CVAIRR page and the Cedar Valley New Residents Facebook page. Asking questions, people sharing all kind of videos and messages that they find in many different resources on the internet that are very, very stressful. I want to let people know to try as much as you can to avoid those messages. This virus does affect Africans. What you see on the internet that tells you, no, it doesn't affect Africans, that it's all a bunch of lies, don't believe it. We see it's spreading throughout the continent of Africa, and we do live here. You are not in Africa right now. The other thing, we also heard that there are people in some of the nursing homes here that don't speak French or English, so they have dialects like Lingala and Swahili that need help. If you have a family member there, please do not just jump off and go visit them. Don't show up there. Give them a call. Call some of these resources. Call CVAIRR, call Embark for interpretation and guidance on how to reach out to them. If you need any help with, like, they offer transportation, getting some places, or at least contacting your doctor if you are seeing symptoms or you suspect anyone in your household might be dealing with something, please just isolate yourself and give somebody a call. Call your doctor first. If you need interpretation, give us a call. We can help you with that. All right. And that is my message. And stay safe. Stay home. Stay home. Stay home for all of us. Yeah. Thank you very much.
Next, we have Domingo Pedro, who is with the YWCA. He is the Multicultural Services Assistant Director.
My message will be in 2 languages, Spanish and Acateco. That's my original dialect from Guatemala. Because we don't get these messages on newspaper or similar media. So this is an opportunity to invite different cultures, ethnicities, or groups. The point of this meeting today is that we don't want you to feel forget it. We want you to know that authorities is here for you. If you don't communicate back to us your message, we don't know what's lacking. We don't know what you're looking for. So also the media, we will ask you to pay attention to them. Some of them are afraid to talk, or even before this came up, some are afraid to call the police because they don't have the right documentation. If that mentality persists or continues, then we're not going to see any difference. So here's my message in Spanish. Buenas tardes a todos. Ahora me invitó el sheriff del condado Black Hawk para mandarles un mensaje. Las autoridades de Waterloo y Black Hawk County quieren informarle a la población hispana que no se sienten olvidados, que hay recursos, pero si no se comunican con nosotros, no sabemos qué necesita, qué le está faltando o cómo mandarles o cómo ayudarles. Hay muchas organizaciones afuera, pero la frustración de ustedes es que la mayoría está cerrado. Entonces, el ejemplo de la Y, llegan 2 o 3, hasta traen niños. Entonces, esta vez, como ven cerrado, ya no van a buscar las ayudas. Me he fijado, ¿verdad? Cuando estoy ocupado dando inglés, la secretaria le da una cita, no regresan, porque queremos que nos atiendan al instante, lo que llaman en inglés walk-ins. Estos días no es para walk-ins. Walk-in significa sin cita. Entonces le pedimos su paciencia. Como le digo, hay muchas organizaciones. Puede llamar a Embark, puede llamar a la Y y preguntar por Domingo qué es lo que anda buscando o qué. Podemos llenar formularios. Tal vez si usted me manda tu documento en mi email, Domingo, quiero llenar tal formulario. Por ejemplo, renovar la residencia. Bueno, puedo llenar eso si me da sus datos. Entonces, ¿qué es lo que sigue? Solo faltaría su firma o el dinero con que va a pagar, copia de sus documentos. También quiero hablar un ratito en mi idioma acateco. Porque Yelshin put mensaje en Facebook, en WhatsApp, en Instagram, Yelshin hay diferentes experiencias. Chica escucharte chalo na cuesta, chica escucharte chalo na escana, pero mana escana, tú mana na cuesta tu ellos cuabo, mana na cuesta tú, mana na culion tu eikuna, van chiqueidi autoridades locales, hasta ku enfermera, en asco doctor, tam kuchate hospital, mana, te hay unos videos tito chimpan ma koya yel, pero ta chuluncia el alto avipan. Nos va a sorprender que digan, en un condado que es Lynn County, 50 millas en Yelkin, no en 71. Abila, tú me pus nada, en menos de una hora, chico, ni que yo, abchun sulco scholbe, mandi número, en machal no siente chiste en el gobierno, ma que yashkati, manchiste junti, tachi alto con enal, yo lo mundo ti, tamán preparado, que Yelkin da un vivir, pero es un eco yalish, es un eco tu compromiso antes de que shin chico fije veces chale na yav ati un mensaje ti acho que es noroeste de Iowa. Acho que un va al número achan 319-234-7589 hatu chine llamarán. O Domingo es un buen chivo chinuan ma te chibute un día porque man todos los que majan guay o majan uno oficina mano hach colleo majan estampilla, majan abogado, pero hay formas, hay modos, hecho un cola en el grupo, a machina san Dios con objeto, igual Dios.
And certainly last but not least, our Director of the Waterloo Human Rights Commission, or I'm sorry, the Director of Waterloo Human Rights is Reverend Abraham Funchess. Not the commission, right?
It's all good. Yes, actually, Sheriff, you said it right the first time. Waterloo Commission on Human Rights. I'm Abraham Funchess. Our telephone number is 319-291-4441. But I'm appreciative for the opportunity just to talk a little bit about some of the challenges we are facing at the Commission. During a time of global pandemic, when there's forbearance, suspension of rent, mortgage, credit card payments, etc., we are receiving calls actually from tenants who are being forced to be evicted, but they have no place to go. And we just recently received a call from someone who is employed, but they were unfortunately diagnosed with the symptoms of COVID-19 and were still being forced to come to work. In order to make this more graphic, the person described to me via phone that the doctor indicated that they demonstrated all of the symptoms of having the virus. This was communicated to the employer, and the employer said, you still must come into work because it's their policy. Obviously, that just flies in the face of conventional wisdom at a time of global pandemic. So we want you to know, community, that we're here. We still want to be supportive of the business class and, of course, the citizens in the city of Waterloo. But you know, the violations of EOC law, as I've just described, is basically, we believe we can make the argument that this is a violation of the American Disabilities Act. You're forcing someone to go beyond the restrictions that were placed on them by a doctor. And during a time of global pandemic as the one that we're experiencing at this particular time, not only is it discriminatory, but it's unethical and amoral, with the knowledge that we even have a state of civil emergency that was just recently released by the mayor. So if you find yourself in one of these predicaments, and I understand that a lot of times we step forward and we don't really have a whole lot of positive information by nature of the work. We tend to share what some would consider negative information, but it's positive to those who benefit. And so we want you to know that if you find yourself in challenging situations, like the situations I just described, and you want to file a complaint, then we welcome you to give us a call at the Waterloo Commission on Human Rights. Again, that number is 319-291-4441. And we would do the best that we can to work among our own agencies and, of course, in a collaborative fashion with other agencies across the city, the county, in order to bring some sense of justice to you. Thank you.
All right, so that concludes our briefers for today. And pursuant to your questions, that concludes our briefing today. So what questions do you have for us today? Yes, ma'am.
I had a question for you regarding the gatherings that you were talking about. We've done a story over the weekend about a church having a gathering where everybody gathered in their cars. Would this be a gathering that would fall under those guidelines that you're talking about that organizations need to not have?
It would. Again, I need people to look at this from the 50,000-foot view. When we say stay at home, what's the advice? Stay at home. They had people taking coffee and donuts car to car, right? I need people staying at home. I don't want to shame anyone, and that's, you know, a great idea. Great idea. But poor execution. Ed.
Probably for Dr. Egbounye.
Absolutely.
With the 6 positive tests that we've had in Blackhawk County, can you tell us how many negative tests that there have been? Maybe I missed it, but.
That's a good question. The state is still working on data for the county level in terms of negative tests. So all the tests that we have right now that's available. It's in regards to the entire state. So we still don't have county level data.
Is that something that you could ask for?
We've asked for that, so they're working on that. So I think it's just they're just trying to capture everybody's information. So.
I wanted to ask you, Nafissa, too. Our rate of infections are quite low compared to our eastern Iowa neighbors, and I sort of like bracketed out even neighbors that were smaller and bigger, and we've still got a very low rate compared to them. Is that a function of testing availability? Is that a function of people adopting the measures? Are you able to sort of quantify that here?
So when you look at the areas whereby there's a huge amount of cases. So let's take, for example, Johnson County. It started off with the cruise, right? And then you have Lynn County where once spring breakers, I'm assuming, are returning, it's an airport hub there. So travel has been really linked with the confirmed cases in regards to Black Hawk County. And I could say also that that's one of the factors contributing to the cases in those areas as well.
Just not as many of our people are traveling, it seems like?
Well, in terms of our confirmed cases, it's travel associated. We haven't confirmed community spread. So I don't know if it's a matter of our people not traveling as much, but these are the cases that we've been able to confirm. And then we've, in other areas, from last weekend, we've heard that there's also long-term care facility and outbreak there.
I wanted to ask you about that and then possibly ask Kris, too, if I could. 21 of the Lynn County's 71 cases, Reynolds mentioned in a briefing today, were in one of the long-term care facilities. That's a pretty significant outbreak. I would think that Kris would probably be worried about something like that, as he mentioned, too. Do you have any worries of that here before we get to Kris?
I think it should be in worry at all times. And so that's why we're urging people to play their part in staying at home and self-isolating when they're feeling sick and implementing those, the 3 C's, so that we can ensure the health of everybody. And we know that long-term care facility, the elderly population, those are the most vulnerable populations. So as Kris mentioned earlier, you don't want that to be one of your grandparents. And so we all have to play a part in our preventative measures.
Yeah, I don't know which building it is down in Cedar Rapids, but what I do know is one of the buildings that had somebody in it that already has a case in it, it was due to the employee. And again, they're asymptomatic. They don't even necessarily know that they have it, and then all of a sudden it's been spread through the building. And the real challenge is we do the best with social distancing, but at the same time there's just so much communal things that go on inside of those buildings, partly because of the cost effectiveness and the design through the years. A lot of us are starting to shift away from that model to try to mitigate some of that, but that's why it's just so imperative that folks practice social distancing and just aren't out to get exposed to that. Because again, you're a carrier and you don't even know it for up to 10 days. Sometimes we're hearing before it really presents. I know it's 5, but sometimes it goes longer than that. And so again, that's where we feel like we're the firefighters, keeping the embers and the sparks out of the tinderbox, because if it gets in there with our residents, it's just next to impossible to stop.
Nafissa, I have another question for you. As far as exponential rate of infections, so this is like where you're getting to a point where we might double every time, and obviously Black Hawk County is probably not at this point yet where but are you looking at sort of modeling in terms of where other counties are at and where the state's at? In terms of, can you tell when or if we're going to hit a peak or a stride, or is it still too premature because we only have 6 cases?
I think it's still premature, but if you look at how within the last 48 hours, how the increase in terms of our cases, these next 2 weeks are going to be really telling of where we're going to be. Not even county-wise, but nationally, right? So I think for us, that's why we're really drilling in on this preventative approach, because it's not that we're saying it's not going to happen, but we want to make sure that we don't overwhelm the healthcare system, and that there's the resources needed in terms of the taking care of those vulnerable populations.
Tony, I had a couple questions for you. When is the next PPE shipment coming from the Strategic National Stockpile?
So we submitted this morning for a very large shipment. Again, every time we submit for a very large shipment, we get a very small shipment in return. That just seems to be par for the course for us. But we have not gotten confirmation yet of the next shipment date. We hope that they follow suit, and it will be within the next 3 to 4 days.
And hospitals around the country have sort of been now tracking their amount of PPE in days until they run out.
Correct.
Is that something the county is doing?
That's the way we're doing it. We're asking them to forecast 7 days out. And again, I think I modeled for you the other day, green, yellow, red. Green means we're good to go for the next 7 days. Yellow means we have concerns. And red means we're either dangerously low or we're out. So that's the way we're asking for forecasting.
How are our hospitals doing in terms of that?
For the most part, we're reasonably green. We forecast on an anticipated level for 7 days. There are certain PPE pieces that obviously we just burn through. Masks and gloves, for example, we just burn through it every single day. And so whether it's based on real cases or not, that's standard operating procedure. And so it doesn't matter if our cases are 6 or 60. We're going to continue to burn through those resources. So we hope that the state recognizes that the federal government recognizes that, and they continue to support and supply.
Now, Reynolds said today that she was actually asking all Iowans to go onto the IDPH's website. They have a fabric mask cutout or something that you can sort of sellers know how they're doing it. Do you know if there are plans to collect those masks, or if you're doing anything similar to help that cause here? There
have been talks about that. The health department talked a little bit about that today, as did the hospitals. There was an original, when those first stories came out, there were plans all over Pinterest and wherever, and it looks like IDPH kind of fixated on one particular design that they are now putting out as kind of the standard. And once that standardized plan has been pushed out, I think that IDPH has kind of approved that as a supplement. We recognize that's not the cure-all, and we do hope that what that does is extends the life of those N95 masks rather than supplements them. So we see that as a life extender for those masks. We know that those masks can work up to about 5 times as long as they don't get wet, and so we're hoping that we can extend the life of the resources that we do have at hand.
And if people want to make those in the community, where do you recommend they drop those off, and what door do they come in?
Well, for now, we want them to be building the right masks, and so I believe that the Iowa Department of Public Health website has the plans on it. Is that correct, Josh? I think that is correct. And then we would ask that they contact the Emergency Management Agency, and we'll make arrangements from there.
Just give you a call.
Correct.
And then Reynolds also said John Deere was making face shields today and all over the state. Do you know if the plants around here are involved in that?
I do not. I have not had conversations with anybody here locally with regard to that. I think it's a fantastic idea, but I've not had conversations locally. And that's one piece of PPE that we've not been able to get, face shields or goggles. Anyone else? All right, folks, that concludes our briefing for today. Tomorrow we will bring the hospitals back, and we will then take a break until Thursday, and then we'll be on that new schedule of Mondays and Thursdays.